A team of researchers conducted a randomized controlled clinical trial to evaluate a new drug for the treatment of cluster headaches. The type of headache which mostly affects men is categorized by excruciating pain on one side of head. After careful randomization and controlling for all of the known confounders, a total of 200 patients with cluster headaches were divided into two groups. The first group of study participants received 40 mg in the form of powder mixed with water. The second received 80 mg verapamil in the form of a labeled pill. Participants from both groups were mixed together in rooms designated for drug researchers purposes and could communicate freely. After study period has finished without any loss to follow-up skipped treatments, the outcome was assessed by trained researchers that are blinded to treatment assignment. Study results have shown that the new drug is more efficacious than the current gold standard by both clinically and statistically significant margins. Therefore, the investigators concluded that this drug should be introduced for the treatment of cluster headaches. However, the conclusions are likely to be criticized on the grounds of which of the following. So there was this new medication that was tried. Okay, the study results have shown that the new drug for cluster headache is more efficacious than the current gold standard by clinically statistically significant margins. The investigator concluded that drug should be introduced for the treatment. Now, what should be the criticization point for this? So the response bias is a type of bias encountered when respondents are giving untruthful, inaccurate, and misleading questions. In this particular case, the results and conclusion of clinical drug trial may have been systematically distorted because study participants could discern which intervention they have been receiving. They could also compare their pain response to that of the other study participants. The participants would then, under their own bias, be likely to think that the new intervention would have been better than an older prior treatment. It is important to ensure double-blind studies are conducted when asserting treatment outcomes to prevent response bias. It should be response bias, attrition, and intention to treat, and sampling bias were not possibility. Observer bias is not possible because we have blinded the observer, but we have not blinded the participants. So response bias is possible because they'll be discussing amongst themselves and they'll feel that the older treatment was not working. So when we are giving them a newer treatment, they feel like no, newer treatment is working, and then they'll give the false answers.
Thanks for watching. Please give a thumbs up and subscribe for more.